Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and today I'm joined by Major Mark Motzoff of the Salvation Army of the Rockford chapter. So talking a little bit about, as you got all the excitement out, vaccination plan has been submitted to the state of Illinois. We're waiting to hear back on any of the areas they feel that we need to adjust. And of course, the state has made some adjustments as we've gone through already, so we know we'll be making some changes. But I want to remind the public of some general principles because I know there's already excitement and anticipation and interest in the vaccine. The 50 counties with the highest death rate will be given the first round of vaccine. Winnebago County, unfortunately, is one of those counties. Local health departments are responsible for the oversight of the initial allocations. And we expect that the Pfizer product will be the first to receive approval from the FDA under the emergency use authorization tomorrow. So tomorrow is the hearing with the FDA. Some other kind of principles about this is that first group will be dedicated toward healthcare providers and residents of long-term care facilities. We need the public to understand, please be patient. There's no waiting list or appointment list or other populations at this time. Please don't call your healthcare provider or the health department ask to be moved up in the priority list. Everyone who needs a vaccine will be able to get a vaccine, but it won't be in the next month or two. And vaccination will be voluntary, and it requires that special consent under an emergency authorization use. The vaccine will require 2 injections, 21 days apart. So it'll be very important for us to monitor and track what type of vaccine was administered the first time and 21 days after that. So we are working very closely with our hospital partners in the Rockford area to be able to take in this vaccine and be able to distribute it to their employees in a short period of time. And the employees that are prioritized are those healthcare workers in direct contact providing frontline work to individuals with COVID. So what can we do while we wait in hope and anticipation and positive spirit? We still need to support the social mitigation measures. We need to continue to mask. We need to continue to social distance. We need to do our frequent hand washing. We need to think and be thoughtful about limiting our contacts outside of our household. It is having an impact. The other news that I want to share with you is about testing. The community-based testing site at Rockton Avenue, operated by the Crusader Community Health Center, will be closed effective Friday, December 11th at 4 p.m. That will be their last day. We appreciate their assistance in helping to make testing available in our community. They stood up testing with the health department at the start of this pandemic before the state brought in their testing. But they also recognize that they need to return to their primary core functions in business. They need to begin to care and plan for individuals to vaccinate within their patient-enrolled populations. They need to be able to prevent hospitalization, so they are working hard to transition back to their clinic settings and their primary care. They will continue to provide testing to their enrolled patient populations as they have throughout this pandemic. And the site at the University of Illinois Health Sciences campus, run by the state, will expand its capacity to be able to accommodate all of the patients that were normally tested through the Rockton Avenue site. The good news is that the site at the University of Illinois now has a web application that will help you pre-register and get your results directly into your phone. I know we've all been waiting for something much more automated rather than waiting for paper results, calling the health department, calling the state. So we want you to please visit Test Directly, that's TESTDIRECTLY.com to pre-register for your testing at that site. They will take you if you do not pre-register, but it will make the process go much quicker if you pre-register. We also are thankful to Total Faith Community Church, located on 1250 South Perryville Road, who will be hosting a pop-up testing this Saturday from 8 a.m. to 4 p.m. Again, no ID or insurance is required. No citizenship questions will be asked. It's a nasal swab test, and it's for individuals ages 2 years and up. So again, we appreciate as Crusader begins to transition back to their home base to give care to their community, we are appreciative of those other organizations that are standing up to help us provide some additional testing capacity. Last week, we also learned that the CDC provided some additional qualifications on quarantining. It is still recommended that you continue to quarantine for 14 days post-exposure. That is the gold standard. It is up to local health authorities to determine the timeframes of quarantine based on the metrics, community transmission, and hospital capacity. With our positivity rate and case count, Winnebago County will continue to follow the best practice of a 14-day quarantine post-exposure. And the reason and rationale for that is getting out of quarantine does pose some risk for asymptomatic transmission. And we are working very hard as a community and a population to keep our transmission low. And again, we need to do our part to minimize the spread as much as possible to support our businesses reopening and our community.